Ocular prosthesis. Questions and answers. What is the primary goal of an ocular prosthesis? Answer: to restore the cosmetic appearance and, when possible, the motility of the eye following removal due to trauma, disease, or malignancy. What are the three main surgical procedures associated with ocular prostheses? Answer: enucleation, evisceration, and exenteration. What is removed during enucleation? Answer: the entire eyeball, globe, and part of the optic nerve while preserving orbital contents. When is evisceration preferred over enucleation? Answer: in cases of blind, painful eyes without intraocular malignancy, particularly with infection, to preserve scleral structure and reduce surgical trauma. What is exenteration and when is it performed? Answer: a radical procedure involving removal of all orbital contents, including eyelids and surrounding tissue, typically for aggressive orbital tumors. What is the function of a conformer after surgery? Answer: to preserve the conjunctival space and shape during healing, preventing socket contracture and facilitating prosthesis fitting. Name two types of orbital implants. Answer: non-porous implants like PMMA and silicone, and porous implants like hydroxyapatite and polyethylene. What is the advantage of using porous orbital implants? Answer: they allow tissue ingrowth, improving implant stability and reducing the risk of migration or rejection. What is pegging in the context of ocular prosthetics? Answer: a procedure where a peg is inserted into the orbital implant to enhance the movement of the overlying prosthesis. P. What are two types of ocular prosthetic devices? Answer: scleral shell prostheses for damaged but intact eyes, and full-thickness prostheses for completely anophthalmic sockets. What material is commonly used for modern ocular prostheses? Answer: polymethyl methacrylate, PMMA, due to its durability, biocompatibility, and ease of customization. How often should an ocular prosthesis be polished professionally? Answer: every 6 months, with complete replacement typically recommended. Every 5 years, number 3. What are common complications associated with ocular prostheses? Answer: discharge, dry eye, implant exposure, ptosis, lid laxity, socket contracture, and peg problems. What are signs of infection in a patient wearing an ocular prosthesis? Answer: green or yellow discharge, red inflamed tissue, odor, and irritation of the orbit. What should clinicians inspect during routine checkups of ocular prosthesis patients? Answer: the prosthesis for damage, the socket for signs of infection or tissue changes, and patient-reported comfort and care practices.